Hello and welcome to this very short little introduction to Essential Somatics Movement. My name is Samantha Holland. I'm an Essential Somatics Movement Teacher and my passion is educating people about somatics so that they can get out of pain, including back pain, which is of course a widespread problem. And Thomas Hanna, who created this particular approach in the 70s, felt that arose largely from the way that we live our lives nowadays. And I won't get into that here. What I want to do in this very short video is introduce you to, teach you the fundamental technique that we use in this work, which is what makes it so effective and also very gentle, and also give you just a taste of some of the way that the gentle movement practice can alleviate and in many cases eradicate back pain that seems as if it won't go away. So I'm going to start by teaching you the fundamental technique, and that's called pandiculation. I'm going to teach it by using our shoulders, partly because they're easy to see on screen, so you won't have to feel awkward about sitting in front of the screen and making the movement, but also because shoulders are part of our back, right? Shoulder blades are the biggest part and they are part of the back and very often implicated in back pain. But also the whole approach of somatic education is that everything is a full body movement, right? So if you have back pain, the problem is not just with your back, it's whole body patterns. So just keep that in mind. I'm trying to keep focused. So to learn pandiculation, first it would be nice to just check in with your breathing, okay, rather than go straight into movement. So can you put one hand or both hands on your belly and just notice whether you're breathing into all of your lungs, so breathing into your belly or not. Close your eyes if it helps. Just notice where your breath is coming in. And make sure your feet are firmly placed on the floor, or put a book under them or something under them, or sit towards the edge of the chair to make sure that you're comfortable and that you're grounded. If you don't feel much movement in your belly, can you put your hand there and really try to encourage yourself to breathe into your belly so you're getting the most oxygen, you're getting the oxygen that you need. And then let the air out so that your back does not stay rigid. Okay. Great. Let your hands down. If it's comfortable for you to do this, can you take the fingers of one hand and put them on the opposite shoulder? Doesn't matter which shoulder you start with. If it's uncomfortable or really not possible to do this, that's fine. Your fingers are here only for feedback. They're not here to press down or to be pressed into. They're just to give you more information for your nervous system. So can you just gently, as far as is comfortable for you, so it might be this far, less, just shrug that shoulder up towards your ear. Let the rest of your body move with it. Don't worry about just making your shoulder move on its own. And then can you slowly, with awareness, just start letting that shoulder decontract. Notice where it's smooth, if it's jumpy or jerky or shaky. Notice whether you can sense it easily or not. Let it come to rest and do not push it past where you want to rest. And then just let that hand go, let your shoulder relax and release. Take a breath, put your hand on your belly. And there you were, pandiculating your shoulder. We'll do that again. I'll explain the three-part process that we did. So part one of any pandiculation is bringing your attention to the area. So you don't stop the rest of your body moving, but you do focus on one area. So you contract the muscles in that area. So just contract whatever muscles you need, it doesn't matter about the physiology of it, to get your shoulder up. That's part one. Part two, the slowest part of the pandiculation, is where you decontract. You slowly, with conscious awareness, release this part of you. Then you might use your fingers to feel which muscles, what parts of you are letting go and which aren't. If there's a jump or a jerk or a shake, notice it. It just means your body's not used to controlling it. Once it rests, just let it rest. This is the third part of the pandiculation. It's crucial because it's the part that now allows your nervous system and your brain to take in the new information you've provided. If you don't do the third part of the pandiculation, then you're just doing exercises or movement. They won't be bad for you, but they won't change anything in the longer term. We'll do that just for a third time. Fingers on that shoulder if it's okay. Contract. Slow, gentle, conscious release. Notice how your shoulder moves, where you're aware of it, where you're in control, and where that's not the case. Just let it go. And breathe. Always remember to breathe. And we're going to do the shoulder on the other side. So just put your opposite fingers on your opposite shoulder. Contract that shoulder up. Notice if the movement is easier or harder on this side. Slowly start releasing. Similarly, notice where is it smooth, where is it jumpy, where does it speed up out of your control, where is it easier to control. Can you feel much at all, right? Let it go. Do that a second time. So contract your shoulder up. Breathe as you ease it into decontraction, sensing what's happening as you do, letting it relax for a moment and release. Do a third pandiculation on this side. Contract up. Slow, gentle, conscious release. And let that go. And really just let everything go. You might want to press pause, just take a moment to breathe, to let your shoulders relax and notice what, if anything, has changed, what feels different, and what differences you may have noticed from side to side. So I'd like you to shift your attention to your back, to your lower back here. Sit towards the edge of your chair so that your pelvis can move, and notice if your pelvis does move. It's not the focus of this short introduction, but all movement is good, really. So first, close your eyes if you will, and can you imagine, and it will be just imagination initially, can you imagine contracting, tightening that part of your back that hurts just a little bit more than it's already tight and contracted? And can you imagine doing that without any fear? Because pandiculation works by consciously contracting the area that we're focusing on so that we can release it further. Okay? If you pull or push or stretch tight muscles, then your brain and nervous system respond with panic, and they will not let you ease them if they sense a threat. If you contract them first, then it's always safe to start letting go, and that is why pandiculation is so effective. So even if you have a sore, tight, painful back, then contracting it even a millimetre more than it's already tight will help and will unlock your ability to release that tension. So let's put that into practice. You can put your hand on your back if that helps focus. Can you breathe in, contract your back ever so slightly more than it's already contracted. See if your chin comes down, your back of your neck lengthens a little to help. Your pelvis might move. And then breathe your way out of that. Let your back release. Consciously let it release. See if it can release a little bit more than where it started from. And breathe. Put one hand on your belly. The other hand, if it's comfortable, can go on your back. And this time, can you consciously breathe into your belly as you arch your back? If you have an arched back, your belly will stick out because it has to, because of the way that your body is made. And can you slowly release the arch in your back? Release the tightness in your back and feel your belly go in. And maybe your front collapses a little. You might feel as if you're slouching. If you're slouching, it's okay, but it might be that you're not slouching at all. Just notice how it feels. Relax, press pause if you need to. And can you take both sets of fingers and put them either side of your lower spine if that's comfortable for you, so you can feel your spine. You might feel quite a lot of tension. Can you contract so that you feel harder muscles, a little bit more tension maybe? Can you feel the contraction making a difference? So because you're able to contract your back more, you are able to release slowly. See if you can let your back release and feel changes, small or large, happening underneath your fingers and the muscles either side of your spine. Let your back release, let your arms come down. And just notice how much movement there was, what you felt, what you sense now. Keep your eyes closed if you're happy to do so, and just breathe. Breathe into your belly, breathe out of your belly. As you breathe in, does your back arch slightly? So then as you breathe out, does your back release slightly? Maybe you can make that movement larger. Maybe you can breathe in and contract your back a little more than you would normally, so that when you breathe out, you can really let it go. Again, press pause if you want to explore that a little bit. So I'm going to ask you to breathe in, arch your back and bring your chin down slowly. Notice if your pelvis rocks forward, down towards your feet. Do your shoulders go back? Does the back of your neck lengthen? Don't stretch it. Don't make the movement that big. Keep breathing. On a breath out, can you release the tension in your back? Let your chin and neck come back to where they were. And just sit back in your chair, even if you're on the edge of your chair. Just rest into it a little. Let it take your weight. And this time, if you're happy to, you can just have your arms by your sides. And just listen for a moment. You're going to breathe in, arch your back, tip your chin either backwards or forwards, whatever feels good, as long as your neck is moving. And bring your shoulders together across your back, maybe rolling your arms out to help them. Right? So you're kind of sticking your chest out and bringing your shoulders back. So you're tightening your back. Don't do it so that it hurts. Never move into pain. But make it as large a movement as you comfortably can. So, preferably with your eyes closed so you can focus on the inside. Breathe in. Gently arch your back. Move your chin either down or up. Roll your arms open, your shoulders come together across your back. Your pelvis will rock forward. You might feel more weight into your feet. Don't stay too long. On a breath out, slowly, with awareness, gently start releasing your back. Start letting your arms and your shoulders release and come forward to your sides. Let your head and neck release. Let your pelvis rock back to sit on the chair more firmly. And breathe. Again, you can pause, you can do that once or twice more, but don't overdo it, especially if this feels like new movement. Take a moment, notice any changes, sense how you feel from the inside. Can you just gently shrug both shoulders up, not too far? And slowly start on a breath out, breathe as you need, release your shoulders down. Let them rest when they get to where they want to rest and push them. That's pandiculation, contract, slowly decontract, release and rest. And we'll just do that gently with your back one more time. You can either put your fingers either side of your spine, or you can just rest your hands wherever they're comfortable. So just gently, consciously contract your back a little more than it's contracted already. Let the rest of your body move with that. And then release your back and let the rest of your body move as you release your back. And just take a moment and breathe. So this has been an incredibly short introduction, but hopefully you have a sense of what pandiculation is and the potential for what it can do. And I hope that you may even have felt some sensation of release from back pain, or at least the potential for that release. And I do hope that you will investigate and explore this work further.